Hi. Now let's discuss about medical imaging, especially in ultrasound imaging. So ultrasound imaging, or I just use it as US, characterization of US is based on the propagation of sound waves through the tissue. But we are using not just like normal sound we are making, but ultrasound, which means the frequency of the sound is higher than typical audible frequency range. So this ultrasound is based on the propagation of high frequency sound waves through the tissue. And ultrasound imaging, I'll discuss it, can be done very fast. So what that means is it not only gives us a structure, but also changes or dynamic changes of the tissue or structure in real time, which when we say real time is like within the interest of our attention, we can see the changes properly. Unlike the X-rays I discussed and CT before, which uses ionizing radiation, now we are talking about sound waves and ultrasound. So that is do not ionizing radiation. So this is safe so that we can use it for pregnant women. You remember, for pregnant women to see the child inside the belly, and also critically ill patient. And this can be also used for therapy with high-powered focused ultrasound beam, which means ultrasound, the sound wave, we can also increase the intensity and even focus the ultrasound using ultrasound lens to focus, and using that energy of this ultrasound to even ablate stones inside our body, or like therapy. So high-powered focused ultrasound is also being useful. So with a tight control, this in general is pretty safe. And think about how to generate ultrasonic waves. You may consider we only need a kind of a membrane to vibrate in a certain frequency of our interest, like let's say 1 megahertz. Then this membrane vibration, like a speaker with high frequency, that will generate a dense and coarse of these sound waves. So in principle, it's relatively inexpensive. And because of this, there are many applications, and ultrasound is one of the most widely adopted medical imaging technology and inside the clinic. So, for example, in emergency medicine, imaging internal bleeding and localized injuries, which is inside the body, we probably use for ultrasound. However, we also need to understand there are limitations in ultrasonic imaging. So, for example, the first is we are using the sound waves through our body, which is mostly in water. But if there is a cavities in air and the bone conduction is, there's a big differences in sound waves. So ultrasonic imaging is not always the optimal through the bone imaging, such as brain through the skull and the lungs, and because there's air and also rib cages. So there are limitations. And another limitation I can think of is we are using sound wave, and based on the, there could be noise involved. So the resolution usually cannot go below like cellular resolution.